race car driver, and a dentist, and an acupuncturist. So today I'm going to share how I use laser acupuncture in my clinic, mostly for sleep medicine and for pain control for infant tactile release. So the reason I use laser acupuncture is because a lot of parents ask us, does tongue tie, lip tie hurt the baby? Of course, baby do feel pain. So we use a laser acupuncture protocol to modify the pain reception of the baby so that they feel less pain. It's also very useful when we use on parents that get very nervous about the procedure. A lot of times we also do the laser acupuncture for the parents to help them to calm them down a bit more. And of course, when we use laser, we don't need to use needles, and a lot of my patients are pediatric patients, so we can't chase them around with needles. Also very good for sleep issues. Chinese medicine been treating sleep issues for thousands of years. Insomnia, sleep apnea. Of course, back then, sleep apnea is still a sleep issue in Chinese medicine. Breathing issue, very helpful because if we can't breathe, we don't get the qi. And we also want to improve the immune system, because if the immune system doesn't work, it doesn't allow us to heal. The laser acupuncture also helped me to diagnose what the problem is. So if the patient feels good after the laser acupuncture, then we know we are on the right path.
Dr. Chan had done some light therapy on Roman for his phonectomies, before his phonectomies, which, to be honest, I didn't really think did much. I was a bit sceptical, but unfortunately he did have quite a reaction to the last procedure. He was just crying a lot, was really, really unsettled, and his crying was causing him to bleed a bit. He wasn't feeding, and after about 10 hours of that, Dr. Chan actually came to our house because I was so worried about it, and did light therapy on him, and he just stopped crying. And then because he stopped crying, the bleeding stopped, and he took a whole bottle about half an hour later and was happy and went straight to sleep. So I was just a bit like, okay, maybe it does actually do something, because the difference was actually quite amazing. So maybe I'm converted now.
So this patient is undergoing aligner treatment, and we use Myomunchi with our aligners to help with the expansion.
That made me.
So she was gagging on the Myomunchi, and that's what we can do to help her to not gag on the Myomunchi anymore. She's also an oral hygienist. So of course, most gagging is due to not able to breathe through the nose. So those points, apart from helping her not to gag, also to help her to breathe a bit better. So I want to do a demo. Would anyone? Okay. The third row. Yeah. You can be the next demo. Have a seat. Do you have anything that bothering you on that side? Okay. So I get you to sit a little bit more forward. Put your hand like this. So I use motor reflex testing to see where the problem is. So I get you to look here and this is. Okay, that's good. So she did pass the dark light test. I get you to stand up. So she's not in dystrophy, which is good, but when she stand up, it's a problem. Check. Okay. How much pain do you have? 4 out of 10. How long has it been? Few days. Okay. You sleep okay? So I did the TMJ first because when I rub the jaw joint, she is better. And then I did points for her breathing as well. So very similar to what I did for the myomyalgia. But for her shoulder pain, we would use the lung meridian on the right side. To treat the bladder meridian problem on the left. So I'm going to show you all these points that I'm using. The reason we use these points on the hand because it's easy to assess in dental surgery. Most people don't cover their forearms. Is the pain worse in the morning or afternoon? So if it's getting worse throughout the day, it's due to breathing. Yeah, it's partly photo biomodulation and also using the acupuncture points. How does it feel? Good. That's good, thank you. So, yeah, that's how quick it can be. It really takes 2-3 minutes. And and that's actually started earlier last year when Roger Price came to our practice. He was showing us how to use the canometer. But my staff there, she kept breathing right and then she revert, and then breathing right and revert. And then I said, well, she needs some acupuncture first. So what we want to see is the complex eye level go above the red line, which is the end-tidal CO2 to be 35 and above. So you can see as soon as I start acupuncture, she's getting better. Look at that. And it's not just once. We do most evaluation with the canometer for our pediatric patients, and we see this all the time. As soon as we start the acupuncture, you can hear the acupuncture in the background. As soon as we start, it gets to the right level. Because a lot of parents ask us whether the acupuncture works. A lot of the kids not able to express how they feel after the acupuncture. So with the capnometry, we're able to show the parents it's actually working. So my journey started when my father developed trigeminal neuralgia, and it's been my mission to try to treat trigeminal neuralgia properly, because pharmaceutical method or surgical method is not very effective long term, and there's a lot of side effects. I learned the motor reflex testing from Dr. Steve Olmos. I'm also the Sydney Centre for his TMJ and Sleep Therapy Centre in Sydney. So this patient came to us with trigeminal neuralgia on the left-hand side of her face, and we can see that she lack of support on the left-hand side as well. So she also has sleep apnea. With treatment, she no longer need to take medication for trigeminal neuralgia. She doesn't have neuralgia anymore on the left-hand side. Her apnea decreased from AHI 6.6 to 28, and RDI to 10 compared to 29 before we started. And Dr. Steve Olmos wrote a very good article, Chasing Pain. If you Google it, you would be able to find it. So acupuncture, the reason I want to learn Chinese medicine is because a lot of those patients, they have other health issues as well. So I did a master's degree in Chinese medicine, trying to understand the body a bit more, because Western medicine not very effective for chronic issues, and Chinese medicine is very good at it. But in our field, Chinese acupuncture been shown to be effective for sleep apnea, insomnia, and there's been articles showing that for kids with ASD, it also improves the language skill and social interaction. So you saw how I used the laser acupuncture. You can see if you have normal acupuncture done before, you would need to lie down there for half an hour, 45 minutes. But with laser acupuncture, we can do it within minutes, and the patient can walk around, you can move around with the patient. Especially a lot of our patients have ASD and ADHD. And because most of my patients are pediatric patients, and we know that a lot of them also have sleep issues, and most of them develop ASD or ADHD due to sleep issues, and to be able to do something that is not invasive to help with their sleep is been very helpful. So this is after laser acupuncture, and but before
getting upset, he hasn't even started. He hasn't even started. Okay. You're getting yourself worked up before this even started.
How is your holiday going?
Good. You got a footy game on the weekend, haven't you?
Oh, really?
You take big tackles on the footy field that hurt more than this.
So they came 2 hours away.
Calm.
Maybe we just have one errand.
He asked for both of us.
Oh, okay.
That's
Trying to get the parents out, but it didn't help. So same acupuncture point. And pretty much after that, he allowed me to start the local anesthetic. So because he came 2 hours away, there's no way we can send him home. So that being very helpful. We do it for most of our frenectomy patients. It does also help them to recover after the surgery. So the points I use is LI4, Sajal 5, small intestine 5, lung 7, heart 7, and PC6. So that's with the laser acupuncture pen. You can also use dental laser. So this is the Lightwalker ND handpiece. So if you have the Lightwalker, you can try to do this, but you do need to get the setting right. Otherwise, it does get quite hot. The reason I use LI4 is because it's the master point for the head. It also helps with breathing, helps to calm the brain down. So in functional MRI studies, they do find that LI4 with liver 3, stomach 36, it affects the limbic system and help to calm the central nervous system down. Sajal 5, very good for headaches, but you can see for some reason, for thousands of years, they found it also helped with the tongue, especially with people with speech issues. So small intestine 5, same, very good for lockjaw, but again, they do find that it helps with baby struggling to feed. Lung 7, it helps with breathing because the lung channel is part of the breathing system. It also will help with headaches, but as we know, a lot of headache is due to breathing issues. PC6, a very good calming point. So if you been buying those seasick bands, that's what the seasick band is pressing on. So it also helps with sleep. H7, yeah, another very good calming point. So that's also why we use it. But for babies, we use auricular acupuncture as well. So battlefield acupuncture was developed for the US Army for PTSD, chronic and acute pain. And these are the 5 points on the ear. So later on, I'm going to show you what happens when we do it as well. So there's been a multi-center study on preterm baby that require eye examination, and they look at the pain score. They find that the pain score is lower with baby that have the auricular acupuncture, and they have lower heart rate, better SpO2. There's no side effects as well. So these are the babies that just finished the lecture. Good morning. Do you feel relaxed? Feel pretty relaxed. So you can see those babies after frenectomy, it's like nothing happened. So those acupuncture points I use, they actually have works in synergy. They actually works in pairs. In acupuncture, there are pairs in what we call a balance system in acupuncture technique. So for airway digestion, we're also using points on the legs. So for some of the patients that need more help, we acupuncture the legs as well. But not only they have synergy horizontally, they also diagonally and vertically as well. So that's why we pick all those acupuncture points. It's a technique developed by Dr. Tan. I find this technique is so effective compared to normal acupuncture that I learned at university. And then last year, one of the chiropractors that worked with me, he said there's an article on acupuncture to help with speech for patients with ASD. And then I look at the article, they're using all my points. Except they added GB20, which is on the top of the head, and the speech area on the scalp as well. So after seeing the article, for a lot of the ASD patients, we're actually including those areas because we do get a lot of patients referred by a speech therapist. And in this article, they found that kids that receive the acupuncture have 50 times better at expressive speech, 18 times better at comprehension, and 7 times better at social interaction. So these are the points again. So I use a few more points, but very similar to what we use. I won't go through the actual proposal of interaction, but if you look at that article, they will go through it. So I used the motor reflex testing before. The reason I use it is to help me to find out what put the patients into the sympathetic state or sympathetic dystrophy, because in order for the body to heal, we need to get the body into a parasympathetic state so that they can sleep, they can digest, and then they can heal. So with the motor reflex test, it's not a muscle test, it's actually a neurology test. We're pressing on the nerve that is inflamed, and then we get that reaction. Because in a chronic condition, whatever the patient tells you is not true. So that's why I like Dr. Howe's series, because every patient minds, they only tell you what they think you need to know. So like this patient here, she came to us, she referred to us by another dentist for morning headaches, and it does get worse throughout the day. She had many treatments. She's seen chiropractor, osteopath, physiotherapist. She's seen multiple dentists. But in the motor reflex test, it was her foot that was indicating that causing her to have a problem. And before I took the CBCT, I said, you have a deviated septum, because we see this all the time. The foot problem is due to not breathing properly, change of posture causing overloading of the foot. So when we took the X-ray, it really showed that she does have a deviated septum and large turbinates. So for her, we didn't really end up doing any treatment for her. We referred to our best ENT to deal with her nose. So the first test in the motor reflex test is dark light test. So I'm going to demonstrate again. She got it first. All right. And what is being bothering you? Yeah. Every morning. Oh, okay. So if she doesn't do her stretches, she will get neck tension every morning. So does it get worse throughout the day or worse in the morning?
Throughout the day.
Yeah. Have a seat. And put your hand like this. So look at here. And really rigid, so don't let me push in. Alright, okay. Yeah. Okay, again. So when she look at black, she does fail. So she failed the dark light test, which means she's in sympathetic dystrophy. So put your hand like that. Okay, again. But when I rub her jaw joint, she's okay. So that means it's her jaw joint too. Dentists seem to have a lot of jaw joint problems for some reason. So I will use the same protocol because she has TMJ issues. I will laser the jaw joint first. So that's the beauty of the laser acupuncture because it also do photomodulation on the problem area. The back of the head is GP Chanty and Anand, which is sleep well because we do want her to sleep better as well. How bad is the neck tension at the moment? Already? Yeah. So she's already feeling better. So LI4, Sanjiao 5. Yes, because lymphatic drainage is usually not draining well due to not using the diaphragm. So you can see that when we do this, if we put a capnometer on, your breathing will already change. So when your diaphragm is moving, then your lymphatic will drain. The other reason we need to use capnometry is because very hard to charge acupuncture for 2 minutes. I just add some points for shoulder. So I'm just working on the lung channel as well, just to help with her shoulders. But most of the time we just do the standard points. Sometimes I don't even use laser, I just massage the point. How does it feel?
Much better, I swear. It's true.
Thank you. So I won't show this video because that's basically what I demonstrated. So this is Dr. Derek Mahoney. Some of you may know him. He's one of the best orthodontists in the world. So I end up taking a sleep bite for him for his nighttime clients. So when the central nervous system is not working well, we will see those infantile reflexes. So the dark light test is actually an infantile reflex test. With the motor reflex test, it allows us to check the priority of the central nervous system. So in the last case, it was the TMJ, so that's why we would laser the TMJ first. So for some patient that is true breathing issues, then we actually laser the back of the head first to improve their breathing. So yeah, like I said, when patient tell you their symptoms, it's a compensation problem. So usually the problem area is actually silent and the patient actually doesn't know. So this case is a 54-year-old female patient. She's a speech therapist. She had long-term daily temporal headache only on one side. She had treatment with chiropractor, osteopath, 2 TMJ dentists that are actually pretty good. She's from Melbourne, so I met her at a conference and I said, we can try some acupuncture. And during the whole conference, she didn't have headache. So she ended up being my patient in August this year. But I just want to show you this, why we use motor reflex testing. So this is when I took her body, but she failed the motor reflex test. So I didn't like that bite, even though I know I'm very good, but it still didn't work. So we took the bite again. So even though, yeah, you can see she can feel it. So the second bite was better. Did anyone spot the difference? The hint is on the chair. So before I took the second bite, I sprayed her nose with tea tree oil to get her to breathe properly. So her headache been pretty good. That's her message in November sent to me. She's been doing really well. She's been wearing her appliance as much as she can because she is a speech therapist, and we make her a lower of 14. So sometimes she does need to take it out a bit during her clinic sessions, but she's doing really well. So this case is quite interesting. 40-year-old female, she's a naturopath. She's actually also an oral monologist from New Zealand. She's been having lifelong pain, injuries, and she doesn't know what to do. So I ended up seeing her when she came. You can see her short joint is degenerating quite a bit. And she has tongue-tie and lip-tie, actually buccal ties as well. But the therapy for her, because of her TMJ issue, she had a full-time orthotic as well. And then we want to get her into a parasympathetic state instead of doing surgery too early. We end up releasing the lip-tie, buccal tie first, and then a month ago we released her tongue-tie, and she's been doing really, really well. She is actually in Roger Price's book, so that's Melody. So if you have Roger Price's book, you will see her full story there. So this is a DDK test. So you can see he's struggling on the left hand. So the DDK test is to test the cerebellum function. Check on your left hand. So he's still struggling after the acupuncture. He's also autistic. And both hands. Yeah, so it's still not working. Better? Still a bit slow. So I just double check with the motor reflex testing. He actually passed all the motor reflex tests, so it's not a structural issue that is affecting his neurology. Then I do the battlefield acupuncture as well. Small hands. In a strict way, you can see the change.
A little extra energy and but at the same time a bit relaxed.
So I find a lot of kids with ASD, we do need to do the auricular acupuncture. I think there's something deeper, and the auricular acupuncture do help a lot. So I use Phonetic Bite for my appliances, and what I don't like is how a lot of dentists being taught how to take the slip by. So I was talking to some people during the conference. I said it's very important when we take a slip by or any bite for any appliance, the patient needs to be in a parasympathetic state first, fully relaxed, can breathe first. So the reason I ended up taking Derek Mahoney's bite was because I was in Brazil, and this was from Stanford. And that's ridiculous. They're testing using George Gauge on how much they want to pull the jaw. That's totally not physiological. So I posted that slide on my Facebook, and Derek saw it, and yeah, and then he was going to test different bite technique and do a sleep study, but I think he liked my bite too much. He ended up not doing anything else. But this is one of the case came to me for sleep appliance. That's her initial airway, her original TMJ position, and then she didn't like my treatment plan, so she went somewhere else, got a Sonomet May with George Gauge. So George Gauge, you're just guessing where the protrusion should be, and that's a lot of dentists taught to take the bite that way. And you can see the TMJ is totally out of the socket with the George Gauge. So she couldn't wake up. She called us because the next day she couldn't get out of bed. She was very dizzy, getting vertigo symptoms. So we got her in, and that's the Phonetic Bite. You can see minimal opening, very big airway. And also the TMJ is at a much better position. And that's the comparison. One is George Gauge, one is Phonetic Bite. The only other bite technique that is similar to phonetic bite is swallow bite and tense bite. But I would say phonetic bite is probably the most accurate. So that's when we took Derek's bite. We did some acupuncture first. Back then, I was still using needles. And yeah, that's the message he sent back, like his appliance. I want to share this case because this patient is 50-year-old. He can't tolerate anything in his mouth. So treatment-wise, we end up only doing acupuncture for him. Also, he changed his diet a bit, but that's before and after airway. So during treatment, he actually lost 15 kilos. He also able to stop gout medication. He'd been taking those medications for 10 years. He wasn't able to walk his dog, and now he's running. He's leg a lot better. He's also actually a husband of a speech therapist we work with as well. So we started treatment close to Christmas 2024, and he repeated his blood test in January. So that's only a month into treatment. And we can see his cholesterol already normalized, his inflammatory marker reduced, his thyroid and kidney function has normalized as well. So we talk about capnometry a bit, and this is his capnometry. So we want to make sure that he's breathing properly. But it took us a few months to get him eventually able to pass the threshold with the capnometer. And one of the methods, apart from acupuncture, is we get him to use this app. It's a kind of a guided breathing app developed by Roger Price and his sons. So it's free. So I would encourage you to try this app as well. This case is a 4-year-old, and he came in because he has emotional issues. He still has sleep issue after tonsils and adenoid removal. So a lot of times we do need to think why they do have tonsils and adenoid problems. A lot of times it's actually due to inflammation, they're not eating properly. So do be careful referring to ENTs, unless you know a very, very good ENT. We work with only one ENT in Sydney because we do find that quite a lot of ENT are not as good. And that's what happened to him. He saw one of the ENT that is not so good. The surgery was very aggressive on the terminates. I do not encourage anyone to refer ENT that cut into the terminates of a 4-year-old kid. You can see the adenoid already coming back. So treatment for him would be to improve his digestion, improve his airway. So we use the capnometry to guide us. So we did the GB20 for him as well as the full protocol. So we can see eventually he did get his breathing right. So one more case.
Thank you. Hello.
Good. So, yeah, how is his sleep at the moment?
His sleep is every day is different. So he could wake up after 40 minutes, he could wake up after 4 hours, and then sometimes he'll sleep the whole night, sometimes he'll wake up every couple of hours and just need constant resettling. Every day is different. Hard to say.
Yeah, so this morning you were saying what happened?
This morning he had woke up at 5 o'clock in the morning and was unable to resettle, so he's been a bit aggro, constantly, like he punches himself in the head.
Yeah.
Out of frustration, but
Yeah.
what the actual reason behind it, I wouldn't know.
Okay.
Yeah.
Alright, that's good.
So-
Thank you. So this is just before the phenectomy. That message is the next day. I was in Singapore doing another presentation, and he already is sleeping better. And then when we got him back in October, that's a month after. So it's been a month.
Yeah.
How is he sleeping?
Very well. Very well. He's sleeping throughout the night, waking up refreshed,
Yeah.
very playful,
Yeah.
you can see. Very happy. So yeah, it's been really good.
All right, very good, thank you.
Thank you.
So imagine having a 4-year-old child that only sleep, wake up every 45 minutes sometimes for 4 years. I'm amazed how well the mom is doing. But now he's been sleeping full every night. And all it is sleep time, buckle time. So I'm going to quickly skip this video because you've seen many surgery already. But the labial filum is actually an acupuncture point. And as you know, a lot of people talk about when we release the labial filum, they breathe better. But Chinese medicine know this for years, thousands of years. So that's my reference. And
May compassion be your compass, intention your guide. In the space you hold, healing finds its way.
And I do have a chapter in Roger Price's book about laser acupuncture. If you want to contact me, that's my QR code there. And I also encourage you to support IOP. Roger Price talked about that already. I'm one of the directors. So yeah, thank you.
Maybe that's the solution. Right. I was just thinking, I don't think we even finished our conversation the other night about what you ended up doing when you figured out your hormones were all out of whack. I don't think we finished it.
Well, I ended up going to a doctor that specializes in hormones.
Yeah.
For seeing my sister, and I felt that she's younger than me. And she was
Oh, okay.
and she did that hormone testing. Allergy and pulled out the
Yeah.
test and all that stuff. My hormones like and so it's sticking in here, and I feel a little bit better now, but so I'm really tweaking the dosage and all
Yeah.
that. I have creams and testosterone.
Yeah.
What else?
Well, you're doing injections, so
No cream.
just cream.
Yeah. But I'm gonna sleep in a little while to figure me out. Because That'd be a little
I hate being an
difficult for
enigma.
us.
I know. I hate being an enigma. So do you think I have like the red light from the face? Do you think it's the same?
I'm gonna ask you.
But this was actually last year, a German company model. So it's used in manufacturing. Yeah, but they are very slow at doing the implementation again. But they promise they will go back in full production. So it is somehow very effective. We test other devices as well because the school is in Germany. So most of the time, but because we use you don't have to override it. You don't have to override it. You can. So, yeah.
Oh, yes, no, I was just trying to find someone who wants to say that. Thank you for your year.
Det mi sa anche questo. Čak ti opanovata. No to ako mi strupneš so mnou zapravení.
Right. Excuse me.
We still need to find out what. So, like I said, sometimes I do something. It's more symptom management, and then, for example, in the second version, we still need to use
If you have issues and then much more to get reattached with the or you think really tired
and most of the time,
Below the shirt. Yeah.
yeah, so the inspiration comes from now. But the problem is, some symptoms, so there's still a lot of things. Yeah, there's still
That was our thinking, maybe if you fix the name, that's the problem, that would be a result.
Wir sind hier in 9a, oder?
Yes, are you fine with holding microphone? Does that work? Gina, that's
For example, if you
When through your phone, there's a line.
then we will use it.
It's on.
Yeah.
So we go.
Now it's muted. And please also when you go to the CMS speakers, it will get a feedback, so high pitch noise. Or okay. Just watch out.
You all set?
Anything else?